Assalamu alaikum. Today we are going to learn the principles of outbreak investigation. I am Dr. Shahroz Nabi and I am representing Department of Community Medicine, GMC Srinagar. Now, introduction. The outbreak investigation is the process of systematic and well-planned investigation and hypothesis formulation of a disease outbreak in a population in a defined geographical location. Can be particular time or particular place, which is done by a team of investigators from the local authorities as well as from the public health department. We shall see in the later slides the components of the investigating team as well as the steps which are involved in outbreak investigation. The term outbreak is used in a situation when diseases or health events occur at a greater frequency than normal expected within a specified period or place. The occurrence of greater number of cases or events than normally occurs in the same place and during the same period as in the past years. A cluster of cases of the same disease occurs that can be linked to the same exposure. Now, an epidemic versus an outbreak. The term epidemic is used in situations that cover a very wide geographical area which involves a large population. Similarly, outbreak can also be used for sudden increase in non-communicable disease frequency. The term outbreak conveys a greater sense of urgency. How to detect an outbreak? There are various ways that you can detect the occurrence of an outbreak, which are mainly surveillance, hospital record by doctors, paramedics, reporting, laboratory data, newspaper, media, village health volunteers. So, what is the purpose of an outbreak investigation? The main purpose of an outbreak investigation is to control the current outbreak, to prevent the occurrence of future outbreaks, and it also gives us a research to provide the knowledge of the disease. And also, it can give us information and we can check evaluation of effectiveness of prevention programs. It can also give us the evaluation of effectiveness of the existing surveillance system. Training of health professionals can also be done by doing an outbreak investigation. And we can also utilize the outbreak investigation to respond to public, political, or legal concerns. Now, let's see what are the components of an investigation team. The term investigators will represent people who are directly involved in planning and conducting outbreak investigation from the start to the finish. The components include the field epidemiologist or primary investigator, then a person from the disease control department, laboratory technicians, specialists in particular areas, public health administrators, and a public relation person. Now, These are some of the issues to be considered before implementing an investigation. Assessing the existence of an outbreak, gathering available basic information, ensuring clinical specimens and suspected materials are collected, obtaining permission and adequate support from local as well as national authorities, planning the field operation. Now we are coming to the steps of outbreak investigation. The first step in the outbreak investigation is to confirm the existence of an outbreak. Like, we need to do a verification. Verification can be done by visiting the place itself or by a telephonic conversation with the local medical officer or epidemiologist from the area. Also, we can do a communication with the local health authorities to confirm the existence of an outbreak. Now, the second step, verify the diagnosis and etiology of the disease. Now, to do this, we need to try to reach a correct diagnosis. It should be as soon as possible so that the susceptible population, which include children, elderly, and those with communicable and non-communicable diseases who are susceptible, can be saved. Also, to verify the diagnosis and etiology of the disease, one has to visualize signs and symptoms, and a discussion can be held with the doctors treating the cases at the hospital or at the local level. You could also visit the laboratory for a confirmation. The main thing is to save the samples so that the investigation can be done, and in future course the samples may be needed to further establish any that any cause of the disease or the pathogen that was involved in the disease. Now we will look at the third step in the outbreak investigation, which is to develop an appropriate case definition and start case finding and collect information on cases. To do this, we need to develop an appropriate case definition. An appropriate case definition is a case definition which can be labeled as a suspected, a confirmed, or a probable case. The active case finding should be done in the community by visiting house to house and to collect information on cases. Also, we can identify information, demographic information, clinical information, and suspected risk factors. Now, the fourth step. The fourth step is to describe the outbreak in person, place, and time, and hypothesis formation. To outline this, we need to look at the main clinical features and to see which population is at risk. Can be male population is more at risk, or a female population. Like likely, we can see which ethnicity is more susceptible, or some occupation which is involved. Also, we need to see all the risk factors that were involved in the present disease. Also, we need to explain how the outbreak began using computer-based analysis or a manual. Testing the hypothesis by analysis. This we can do by establishing the etiology of the disease, the source of infection, the pattern of spread, and the risk factors. The sixth step is environmental or other studies to supplement epidemiological findings. We can see the effect of environment on the disease spread. Seventh step. Seventh step is establishing the cause of the outbreak. It can be done by having a lab evidence, by clinical evidence, by environment and epidemiological evidence. The eighth step. The eighth step includes on-spot reporting to and recommendations for the concerned authorities. This involves complete analysis and data interpretation to present main findings and recommendations. Timely reporting is necessary to avoid and to stop the occurrence of the outbreak. To answer some questions regarding how to control outbreak, to prevent future outbreaks, to improve investigation, and to improve surveillance utilization. The ninth step in the outbreak investigation is the dissemination of information. The dissemination of information can be done weekly, monthly, or by media, journals, or by telecommunications. The tenth step and is a very important step to follow up to ensure implementation of control measures. One needs to follow up and maintain a close communication with the local health authority to give the feedback and also to monitor the implementation recommendations are being implemented accordingly. We also need to look at the absence of new cases for due incubation periods, which could suggest outbreak is subsiding. So we also need to learn why recommendations were not implemented, and we can see the impact of implementations. So to summarize the 10 steps of an outbreak investigation, the first is to confirm the existence of an outbreak. Second, to verify the diagnosis and etiology of the disease. The third is to develop an appropriate case definition, start case finding, and collect information on cases. The fourth step involves to describe the outbreak in person, place, time, and hypothesis formation. The fifth step includes the testing of hypothesis by analysis. To sixth step, this is the environmental or other studies to supplement epidemiological findings. The seventh step is to establish the cause of the outbreak. The eighth step involves on-spot reporting and recommendations for the concerned authorities. The ninth step includes the dissemination of information through mass media and telecommunications. And the tenth step is to follow up to ensure the implementation of control measures.